Just for those of you who may not be familiar with us, we are Health Outreach Partners, or HOP. We're a national nonprofit organization based in Oakland, California, focused on things like access to care and health equity by advocating for outreach. We see its importance in really connecting to vulnerable and underserved communities, building trust and relationships, and facilitating access to care and other social services. So you see our mission is really to build these strong, effective, and sustainable health outreach models. We do this through trainings, consultations, as well as providing key outreach resources. We work primarily with health centers, as well as primary care associations and other safety net organizations, as well as in partnership with organizations like NCFH. So you can see our website is listed up here. I encourage you to visit it. It's been recently redesigned, and so you can learn more about us and then check out our resources as well. This is our agenda for today. Again, we're here for 90 minutes. We're starting with the welcome and intro, and then I'll turn it over to our first guest speaker, who will provide an overview about long COVID, and you'll have the opportunity to ask some questions at the end of her presentation. And then our second speaker will put this more in context within the Farmworker Health and really considering their health as well as their families. And then we'll want to hear from all of you in a breakout activity around perhaps what are some effective outreach strategies around long COVID and farm workers. And then you'll also have another opportunity to ask some last questions. But we just want to remind you, if you do have questions, please feel free to put them in the chat box throughout the webinar, and we'll look at those and be sure to present those to our different guest speakers. And then we'll wrap up with a brief evaluation. And then just finally for today's webinar, we set forth these 3 learning objectives. And so we're really hoping that at the end of the webinar, you all as participants will first be able to really review this long COVID, the signs, the symptoms and conditions, and understand the impact it can have on communities, specifically farm worker communities, be able to analyze the benefits of the vaccine, COVID vaccine, be able to promote it, as well as other recommended precautionary measures, and identify ways that outreach can support farm worker communities in management and prevention of long COVID. So with that, let me first introduce our speakers. Today we have Dr. Nicole Ford. Dr. Ford is a public health professional with interests in chronic disease epidemiology and surveillance system building. She has 15 years of experience in public health research and programming. Currently, Dr. Ford is the senior health scientist on the post-COVID conditions and long-term sequelae team at the Centers for Disease Control and Prevention. And then our second speaker today is Stacy Jenkins. Stacy is the online learning director with AgriSafe Network, and she collaborates with content experts from across North America to explore health and safety issues in agriculture and share this information through webinars, courses, and training materials. During the COVID pandemic, Stacy was really instrumental in AgriSafe's response by identifying emerging research, crafting content for educational pieces, and launching learning opportunities, especially for rural audiences. So we're happy to have both of them joining us today. So welcome, and I'm going to turn this over now to Nicole.
Thank you, Sonia. I'm going to share my screen now. Okay, so we are going to start with an icebreaker, a little warm-up activity. We're going to do a few true or false questions to see what people already know about long COVID. So please feel free to type your response in the chat box as we go through these questions. Our first true or false question: only people hospitalized for COVID-19 can have long COVID. Give everyone a minute here. This is false. Anyone who's been infected with COVID, with the SARS-CoV-2 virus, can experience long COVID. Our next question: true or false, long COVID symptoms may appear, resolve, and then reappear. This is true. Symptoms can last for weeks, months, or even years after infection. Sometimes the symptoms can go away and come back again. For our final question for our icebreaker: true or false, people experiencing long COVID are eligible for disability. This is true. As of July 2021, long COVID was added as a recognized condition that can result in a disability under the Americans with Disabilities Act, or the ADA. My objectives for today's talk are to provide an overview of long COVID, what it is, what's the burden in the US, and what are some management strategies. Then I'll review how you can protect yourself and others from COVID-19. And then finally, I'll wrap up with what CDC is doing to address long COVID and provide some links to some resources. To start, what is long COVID? Long COVID is a wide range of new, returning, or ongoing health problems that people experience 4 or more weeks after being infected with SARS-CoV-2, the virus that causes COVID-19. People call long COVID by many names, including post-COVID conditions, long-haul COVID, post-acute COVID-19, long-term effects of COVID, and chronic COVID. The term post-acute sequelae of SARS-CoV-2 infection, or PASC, is also used to refer to a subset of long COVID. CDC uses the term post-COVID condition, so sometimes you'll hear me refer to long COVID this way during this presentation. There are 2 large buckets that help explain post-COVID conditions. First, there are the general consequences of illness and hospitalization. So people who experience any type of severe illness, hospitalization, or treatment may develop problems such as post-intensive care syndrome, also called PICS. These effects can include muscle weakness, problems with thinking and judgment, and symptoms of post-traumatic stress disorder. While PICS is not specific to COVID-19, it may occur and contribute to a person's experience of long COVID. Next are the post-acute consequences of the SARS-CoV-2 infection, or PASC. Some people, especially those who've had severe COVID-19, experience multi-organ effects or autoimmune conditions. Multi-organ effects can involve multiple body systems, such as the heart, lung, kidneys, skin, and brain. As a result of these effects, they may be more likely to develop new health conditions like diabetes, heart conditions, blood clots, or neurological conditions, compared to folks who have not had COVID-19. Additionally, some people with long COVID have symptoms that are not easily explained by tests, or those that are easy to manage, such as chronic fatigue syndrome. People with these unexplained symptoms may be misunderstood by their healthcare providers, and this can result in a delay in receiving a diagnosis and appropriate care or treatment. So conditions in these 2 different buckets can frequently overlap, and patients may experience them in any combination. People who experience long COVID most commonly report general symptoms, such as tiredness or fatigue that can interfere with daily life. cardiovascular and respiratory symptoms like cough and heart palpitations, digestive symptoms like diarrhea, neurological symptoms like difficulty concentrating or thinking, which is sometimes referred to as brain fog, and other symptoms such as joint or muscle pain. These symptoms can last for weeks or months, or even years after infection, and then sometimes they can go away and then come back again. Scientists and researchers are investigating how acute COVID-19 develops into long COVID, but we don't know the exact mechanism or mechanisms that this happens. Some of the proposed mechanisms include viral persistence, which means that the SARS-CoV-2 virus remains in some cells or tissues and isn't cleared by the immune system, systemic and tissue-specific inflammation, autoimmunity, where the immune system attacks healthy cells in the body by mistake, and microvascular dysfunction, which is where the small vessels leading to the heart aren't functioning as they should. Understanding how acute COVID-19 develops into long COVID could help researchers develop treatments for long COVID. Long COVID may not affect everyone in the same way. People with long COVID experience health problems of different types and combinations of symptoms that may persist, resolve, and then reemerge over different lengths of time. CDC analyzed data from the Innovative Support for Patients with SARS-CoV-2 Infections Registry, also known as the INSPIRE study. It's a cohort study, which is a type of study that follows participants over time. They monitored self-reported COVID-19 symptoms at 3-month intervals from participating adults to evaluate the prevalence of emerging and persistent symptoms. This study found that COVID-19 symptoms generally decreased over time following an acute illness. However, approximately 16% of participants had persistent symptoms at 12 months. At each study point, some of the symptomatic persons had ongoing symptoms and others had new symptoms that were not reported during the previous period. Researchers are working to understand which people or groups of people are more likely to develop long COVID and why. Studies have shown that there are groups of people who may be affected more by long COVID, such as people with female sex, those with older age, those who had severe COVID-19 illness, those with underlying health conditions prior to having COVID-19, and those who did not have the COVID-19 vaccination. Some people are at increased risk of getting sick from COVID-19 because of where they live or work, or because they can't get health care. Scientists are researching some of these factors that may place communities at higher risk of getting infected with SARS-CoV-2 or with developing long COVID. So what is the burden of long COVID in the United States? In short, there's no single estimate of how many people are affected by long COVID. Published estimates of long COVID incidence among non-hospitalized adults with COVID-19 range from about 7.5% to 41%. But these estimates can be quite different depending on who is included in a study, as well as how and when the information are collected. CDC uses multiple approaches to estimate long COVID. Each approach can provide a different piece of the puzzle to give us a better picture of who's experiencing long COVID. For example, some studies look at the presence of long COVID based on self-reported symptoms, while others collect symptoms and conditions that are recorded in people's medical records. Some studies focus only on people who've been hospitalized, while others include people who were not hospitalized for COVID-19. Further, there's challenges in understanding long COVID itself, which also contribute to the reasons for the variation in the estimates of how many people are affected by long COVID. We do have some information about some of these estimates, so I'd like to share some of the more recent data with you today. In the Census Bureau's Household Pulse Survey, which includes non-institutionalized US adults who are aged 18 and older. The data from June 28th through July 10th, 2023, so recent, found that slightly more than 1 in 10 adults who've ever had COVID-19 report currently experiencing long COVID. The prevalence differs by demographics and is higher among females compared to males, and is lower among non-Hispanic Asian adults compared to non-Hispanic white, non-Hispanic Black, and Hispanic adults. Another recent study from CDC using data from the Household Pulse Survey evaluated trends in the prevalence of long COVID. So looking at COVID over time, long COVID over time. Prevalence of long COVID in adults, US adults aged 18 and over, decreased from 7.5% in June 2022 to 6% in June 2023. And from about 19% to 11% among adults who've reported previous COVID-19. After an initial decline from June until January 2023, the prevalence has remained stable from January 2023 until June 2023. Importantly, roughly 1 in 4 adults who've reported long COVID also report significant activity limitations. Long COVID includes more than just reported symptoms. CDC analyzed the occurrence of 26 different clinical conditions in electronic health records from March 2020 through November 2021, including roughly 63 million unique adult records. Patients were followed for 30 to 365 days after their initial acute COVID infection. 38% of the case patients and 16% of the controls experienced at least one incident condition, such as kidney failure. Children and adolescents are also at risk of long COVID. CDC studied 15 conditions and 8 symptoms among more than 500,000 US children with COVID-19, compared with over 1.5 million children without COVID-19, using medical claims to estimate the increased occurrence as potential post-COVID conditions. These authors found that there were 9 post-COVID conditions and 4 post-COVID symptoms, most of which were rare or uncommon, that were more likely to occur among children with COVID-19, including diabetes. So what are the management strategies for long COVID? There are several clinical challenges in diagnosing and managing long COVID. There is no single test to determine whether a symptom or a condition is related to having had COVID. As we saw in a previous slide, there are many different patient-reported symptoms. Some of these symptoms, such as chronic fatigue, are often not explained by objective tests like a chest X-ray. In the absence of these objective tests, patients can be misunderstood or stigmatized. To date, there is no clinical trial data or data on management outcomes for long COVID. CDC has developed information for healthcare providers on evaluating and caring for patients with long COVID. These resources are available on CDC's website, and the links will be posted here in the chat. Most post-COVID conditions can be diagnosed and managed by primary care providers. It can be diagnosed clinically based on history and findings on routine physical examination. Routine tests like blood tests and chest X-rays may not be informative because they may appear normal even if someone does have long COVID. Clinicians can consider a conservative diagnostic approach during the first 4 to 12 weeks, where many patients continue to recover. Signs and symptoms of urgent and potentially life-threatening clinical conditions like heart attacks still require immediate workup. Symptoms persisting beyond 3 months should also prompt further evaluation. While many patients still recover after 12 weeks, persistent illness becomes more likely after this point. Finally, it's important that clinicians listen to and validate their patients' experiences and partner with patients to achieve to identify achievable health goals. For most people experiencing long COVID, the goal of medical management of long COVID is to optimize function and quality of life. So ideally, healthcare professionals in consultation with relevant specialists would develop a comprehensive management plan based on the patient's presenting symptoms, underlying medical and psychiatric conditions, a person's personal and social situation, as well as their treatment goals. For people with long COVID, CDC has also developed tips to help prepare for healthcare provider appointments. These can be found on CDC's website, and the links will also be added to the chat here. Tips include how to prepare for your appointment, such as writing down a list of symptoms that you think started after your COVID-19 infection. Suggestions to help make the most of your appointment, such as explaining your most concerning issues first and feeling empowered to ask questions. And then steps to take after an appointment. So understanding follow-up and making sure that future appointments are in place. CDC's healthcare appointment checklist for post-COVID conditions, which is shown here on this slide, is designed to help patients and caregivers get the most out of appointments with healthcare providers when meeting about long COVID. And again, these are available online. How can you protect yourself and others from COVID-19? The best way to prevent long COVID is to protect yourself and others from getting COVID-19. For people who are eligible, CDC recommends staying up to date on COVID-19 vaccination. COVID-19 vaccines help the body develop protection from the virus that causes COVID-19. And although vaccinated people can still get infected with the virus, staying up to date on vaccines significantly lowers the risk of getting very sick, being hospitalized, or dying from COVID-19. Next, getting tested if you have COVID-19 symptoms. Testing may help you make informed decisions about your own health and your risk of spreading COVID-19 to others, especially those who may be at higher risk of severe illness. If you are infected, seek treatment for COVID-19 if you're eligible to prevent severe illness. Treatment must be started within a few days of symptoms for it to be effective. If you don't have a timely access to a healthcare provider, you can check to see if there's a test to treat location in your community. Improving ventilation and filtration can also help prevent COVID-19 by helping stop the virus particles from accumulating indoors. Ventilation is moving air into and out of or within a room, and filtration is trapping the particles on a filter and then removing those virus particles from the air. Actions that can improve ventilation include opening windows, changing HVAC filters frequently, using HEPA filters, and turning your thermostat to the on position instead of the auto position to ensure that the HVAC system is providing continuous airflow and filtration. Similarly, people can consider moving indoor activities outdoors. You're less likely to be infected with COVID-19 during outdoor activities because the virus particles don't build up in the air outdoors as easily as much as they do indoors. Additional preventive measures include wearing a high-quality, well-fitting mask to help reduce the spread of COVID-19. Masks are made to contain droplets or particles that you breathe, cough, or sneeze out. Basic health and hygiene practices, such as washing hands and using alcohol-based hand sanitizer, can also help prevent infection. What is CDC doing to address long COVID? CDC is working to characterize long COVID by identifying risk factors, groups who are disproportionately affected, and the health and the financial costs of long COVID. CDC is also working to identify successful interventions to prevent and lessen the effect of long COVID. And CDC is also working to disseminate clinical guidance and other education materials for healthcare providers, patients, and the public to improve understanding of long COVID. There are a few important messages I'd like people to take home from this presentation today. First, long COVID is not a single condition. It is multiple symptoms and conditions that people may experience in any combination. These symptoms may appear, resolve, and then reemerge over time. Next, long COVID is not uncommon following SARS-CoV-2 infection. The recent CDC study I mentioned previously found that roughly 1 in 10 adults with previous COVID-19 reported currently experiencing long COVID in early July of this year. However, there are a range of estimates of the number of people affected by long COVID due to the differences in different study methods and also the populations that are studied. Management of long COVID is complex. Engagement with patients, healthcare providers, and caregivers can help reduce the impact on people's daily activities. And finally, the best way to prevent long COVID is to prevent COVID-19. Here are links to resources from CDC for people experiencing long COVID, for caregivers of those who have long COVID, and also for healthcare providers. The links are also placed in the chat box. Additionally, there's a link from the Health and Human Resources website that includes guidance on long COVID as a disability under the Americans with Disabilities Act. So thank you for your time. I believe we'll also have a few minutes for questions, but we'll also put my contact information in the chat if we don't have time to get to everyone. So thank you very much.
Great. Thank you so much, Nicole. That was very informative, and we have a series of questions. So I'm going to read some of those out to you. So let me start.
Thank you.
With that, I want to invite Stacy from AgriSafe to present on implications, what we need to really think about when we think about farm worker health and long COVID. So Stacy, I'm going to turn it over to you.
All right, thank you, Sonia. Yeah, so I'm really excited to be here. My name is Stacy Jenkins. I work with AgriSafe. We are a national nonprofit focusing on the people who are doing the work of growing our food, raising animals, working in nursery facilities, anything where you're involved in agriculture. We're really trying to pay attention to the ways that work impact the people. So our goal as an organization is to continue to stay ready, to look at the ongoing needs assessment of agricultural producers and workers, train rural health professionals across the United States, work with other NIOSH ag centers, rural research centers, and other NGOs to make sure that we stay connected to other partners who are working in this space, and then continuing to maintain that culture of readiness and response, because things like COVID happen, and we can give people better answers, connect people to more effective resources when we are working together. So for my time, I was asked to talk a little bit more from the farm worker perspective about what long COVID means. And so I'm going to use a little bit of time to describe terms and definitions, so we're using the same language. Share a little bit about the total farmer health model that we use here at AgriSafe. Think about exposures on the farm from an infectious disease perspective, and share some resources that we do have about long COVID. Although I can tell you it's still a big gap area. This is an area where we're still getting more information, and as more time goes on, we'll have better information to share with people. So to start with, a farm worker is really anyone who's employed to work in an agricultural workplace. We recognize that that looks very different depending on the type of agriculture, the state you're working in, the county you're working in, the physical location may look very different. So it's there's not one thing that we can describe as farm work or as a person who is a farm worker. The work that they do varies widely, and so our responses to them need to be appropriate to the work that they're doing and the exposures that they do have. Two other terms, I just want to make sure we're kind of starting from the same place. We hear migrant used a lot, and this, in the context of my presentation today, is used to describe people who move to find work. And then an immigrant would be a person who has relocated to a new home different from their place of birth. So a migrant may be an immigrant, but the two terms are not interchangeable. I'll try to use those in the ways that the definitions we've been given, and make sure we're using similar language. So this applies here on this next slide, because farm workers can be either seasonal, and somebody who maybe is employed. I worked as a detasseler in the summertime, so I would spend most of July pulling tassels when I was in middle school. Seasonal farm workers typically can return to their place of residence at night. So they are doing something that has a shorter time limit, or maybe a more seasonal time limit on that work. A migrant farm worker would be an individual who travels to the job site but is not reasonably able to return to his or her permanent residence within the same day. So just understanding these terms helps us think about COVID and think about how, when we're dealing with farm workers, we need to understand a bigger picture about who they are, where their work is. I do the last statement here too, I don't want to skip over, but guest workers who temporarily live in the US through the federal H-2A program work in agriculture, also described as migrant farm workers, because they aren't able to return home every day. So as I mentioned, this is the total farmer health model here. It's a graphic image of what we've already been talking about, how things like fitness, healthcare, the weather, sleep, cognition, spirituality, all of these circles that you see here impact us as people, whether we work in agriculture or not. This is based off of the total worker health model that CDC NIOSH has put out, and AgriSafe is a total worker health affiliate. It's really helpful, I think, in expanding what we think about farm workers and the role that COVID plays for them personally, for how the ways that they show up at work. And COVID did impact all these different areas of our lives. So we do need to pay attention to bigger than just work or home. All of these things have an impact on us. So one other tool I want to use to talk about who farm workers are is the National Agricultural Worker Survey. The most recent version that's available was from 2019 to 2020. They did face-to-face interviews with more than 2,000 farm workers. So this, just using this as a snapshot about who is involved in agricultural work, because again, it does matter when we think about what long COVID means in agricultural communities. 63% of the farm workers interviewed were born in Mexico, 30% were born in the United States or Puerto Rico, 5% in Central America, and 2% from locations all over the world. So we have farm workers who speak many different languages. They come from lots of different contexts and are in the United States for work purposes. And a lot of them were in the United States for at least 10 years. Most of the farm workers were able to work near home. About 15% of the farm workers in this study were migrants and followed the crops throughout the season. Many of the farm workers are male. I don't want to forget the reverse of all of these statistics though too. So while 66% were male, we do have a lot of people who could potentially be pregnant, or who maybe are dealing with preconception time, different exposures that are important for us to think about when we consider who the farm worker population is. The average age was 41 years. And again, the range was very wide. There were very young children involved. And then there were also people working well into their late 80s and 90s who were participating in this study. We have parents who are farm workers. We have married people and unmarried people. We have people who own their own home and people who don't. I do want to bring up that about 14% lived in employer provided housing. And probably more importantly than a lot of the other pieces of this is half of the farm workers had health insurance. So a lot to think about when we try to layer in COVID and caring for people who have who are working in agriculture. Working in agriculture, as I said, is very diverse. There are many, many different jobs that are a part of what farm workers do. We can have people working in dairies where they're dealing with dust, they're dealing with animals, they're dealing with manure. They may have chemicals or pesticides that they have to work with. They are likely outside in the heat and in the cold. There's a whole range of exposures that are just part of the work that we do in ag. And they're not all, I'm not putting judgment on them as much as just recognizing that sometimes there are things that will impact our bodies in different ways related to our work. You'll see a lot of these things actually overlay with COVID. So the farm worker may already be wearing respiratory protection because of a chemical that they're applying. And so they, in addition, would have protection from COVID because they're not going to, they get the added benefit of not getting the infectious disease because of the PPE they're already wearing. This list is not all inclusive. There are lots of other things that happen in agriculture. We do know that agriculture is very dangerous and that a lot of our farm workers are doing the most dangerous activities. Just one snapshot, one piece of the puzzle about how dangerous work can be. This is from the Bureau of Labor Statistics. They take a look at fatalities. So again, these are just things where people will die. This doesn't count disabling injuries. This doesn't count work lost time injuries. This is just fatalities. And while they organize this chart from highest to lowest and the number of fatal work injuries, transportation and material moving has the most overall, but agriculture still has the highest rate. So when you pay attention to how many people are actually involved in this work, agriculture as an industry continues to be if not the most dangerous, one of the most dangerous industries out there. So when we're thinking about farm workers, we have to understand that they're coming from this environment of difficult and sometimes dangerous work. So kind of to review and bring back some of these things, all these circles of our total farmer health model and relating this back to COVID. There are many, many languages spoken in agriculture, and one language isn't going to be right for everyone. So training and healthcare is needed in multiple languages. We need access to people who speak lots of different languages and who can understand health and safety. We also recognize that work authorization status impacts job security, and this may prevent people from seeking healthcare when it's needed. Structural racism is identified by the CDC as a public health problem, and discrimination make accessing healthcare more difficult. It is different. As you saw, less than half of farm workers have health insurance. It's a big barrier for people who are trying to seek care. And if you are sick with COVID or long COVID, not having health insurance keeps you from being able to go get the care that you need to stay healthy and to continue working. Ag work happens in rural and medically underserved areas. We know that places where farm work and other agricultural work happens are distributed. They may have multiple locations for one farming facility. And they are less likely to have specialists and other people who can provide care. Even if it is available, there are fewer providers per person. And we mentioned that a portion of our farm workers are migrant, and they are following crops as they are ready for harvest. It's difficult to maintain continuity of care when you are not in the same place for more than a couple weeks of time. Maybe you're moving from pear harvest to grapes, or you're following whatever is available in the moment. Even following the wheat harvest up the Midwest stream, you're continuing to move and relocate depending on where the work is. Many farm workers are living in rented homes and often near many other people. So the opportunities for coming in contact with others or people who have COVID do increase. COVID obviously is an infectious disease, and you have to pay attention to the workplace settings that farm workers are in. So if they are sharing housing, you need to think about infectious disease transmission for them at home. Transportation may be shared. You may have multiple people carpooling to a work site. There may be busing, depending on what the scenario is. Bathroom facilities, tools, shared workstations, break rooms, shops. It's going to vary depending on the facility or the workplace. But we need to be paying attention to how we're equipping people to be safe in spaces where disease transmission is possible. So I think you heard Nicole say a couple of times that preventing getting COVID is the best defense against getting long COVID. Vaccination continues to be our best tool at the individual level for keeping ourselves safe, as well as protecting the people around us. From an ag work perspective, there are opportunities to adjust where tasks happen and which people are involved, how many people are involved. If you're cleaning green onions, to be able to package those up and take them to market, maybe spreading people out, moving them so that they're not facing each other when they're doing a task. There are several different scenarios like that where you can adjust the task and the people to make the risk lower. We've learned a lot about sanitation for surfaces, for cleaning countertops and other places where people washing their hands. That there are lots of tools available that we know now about COVID. And Nicole also mentioned ventilation. The latest NIOSH guidance has 5 ventilation changes per hour as a target. So thinking about cycling all the air in and out of a space 5 times within a 60-minute window. Those are goals. Again, there's more information if you're interested in specific ventilation guidance. There is quite a bit more on NIOSH, but just thinking about, opening windows is a really simple solution, but it does make a big difference in pulling and cycling air in and out of space where people are sharing air. We know personal protective equipment makes a big difference on the individual level as well as a collective level. Wearing a appropriately fitted respirator, it does protect you from getting sick. One of the other things that's come up in COVID often, we've seen in several different settings, is that paid sick leave for farm workers is really missing, and that people will come to work sick because they want to get paid, which is you can understand. And so having some paid sick leave, whether it's what that looks like for each setting is going to be different, and there's no one size fits all metric, but having some option where people are encouraged to stay home when they're ill would make a big difference in infectious disease prevention. And lastly, supporting healthy minds and healthy bodies throughout. Mental health is a big piece of what helps keep people well, as well as healthy bodies, healthy foods, making choices that are going to put you in the best position to manage whatever infectious disease storm comes next, and long COVID as well. Long COVID, as we've mentioned, can be recognized as a disabling situation, and there are legal services for benefits. It varies so widely right now. It's really hard to give one set of information. Most of it will vary by state. So your state offices will be most likely able to help you. I do want to mention, like, under ADA, workers have a right to request accommodations to their work. So there are good reasons that you could come back to an employer and say, I can't carry this load this far. I need some other tool that's going to help me do this differently. So some of those types of things can make work easier for farm workers, and they have, again, under ADA, they have that right to request modifications to their work. Clinicians can play a vital role in documentation that can help support with disability and recognizing long COVID-related symptoms. One of the resources here, this one from the Farmworker Justice Group, Long COVID Farmworker Rights and Protections. I would encourage you to check that one out. They did an issue brief about long COVID specifically for farm workers and the disability resources that are available for, it is developing as our description of what long COVID is changes and our, more time passes, we're gonna have better resources and options available for people. It's still a changing conversation. But there are services and resources available for people. The other one I wanted to draw attention to too is from the Migrant Clinicians Network. And this one was titled Long COVID and Historically Marginalized Patients. Just a different approach of looking at how we respond to people with long COVID from different settings. So a couple organizations that are already, the National Center for Farmworker Health, obviously they're already doing a lot of work in this space. Migrant Clinicians Network, Proteus, the NIOSH Ag Center, it's called the Great Lakes Center for Farmworker Health and Wellbeing, is just getting up and going, and they're based in Chicago. They're gonna have a big part in understanding farmworker health and long COVID. And then also AgriBility. I don't know how often we talk about them, but AgriBility is a federally funded project to help people with disabilities continue working in agriculture. And disability can be arthritis, it can be chronic fatigue, it can be loss of a limb or some other kind of traumatic injury, but not only that, they can help find work accommodations for people with a range of conditions that keep them from doing work in agriculture that they want to do. So AgriBility is state-based. The programs are actually run by states, and not every state has one, but every state is served by AgriBility across the country. All right, I think that's the end of my part here, so I'll stop sharing my screen.
Great, thank you, Stacy. We have several questions for you, so I want to get to that. But before we start, just interest of time, there was one question for Nicole. I'm wondering if we can just hop back to that, and then Stacy, I'll get to the questions that we have for you.
No problem.
Okay, Monica. Hi, Monica. I think you said that you can share. You can unmute yourself.
Sure, I'm here.
Thank you.
Monica Garcia with MHP Salud. I was in the discussion in Spanish, and I think there's interpretation, right? Just in case other people need to.
Yes.
Okay, great. So some of the things that were brought up, Carlos, I've known Carlos Barentes here in El Paso, which we're in the border region here in El Paso, Texas. And some of the things that were discussed is the need for health centers or clinics, right, that serve migrant and seasonal agricultural workers to understand that what is the issue with long COVID and not dismiss what the agricultural workers are feeling or going through. One of the things that was discussed was that there are farm workers that have worked in areas specifically like where we're at in our region, where we experienced extreme heat for 2 months. And many of them were relating that heat to their symptoms when in fact they have been carrying these symptoms for quite some time now. And so it's really looking at health centers having that knowledge and information to identify what farm workers are going through and seeing if they do qualify, right, for disability or any other long COVID assistance, right? Another thing that was said is continuing the outreach for like vaccine in this farm worker community, and really like highlighting one of the things that was shared was to highlight that the vaccines have the defense against some of the new variants, right, that we're seeing. And so that was something to look at, and getting access to resources and information to do that outreach. That was something that was also discussed. No sé si mi grupo quiere decir alguna otra cosa. Esas son algunas cosas que compartimos. So I don't know if my group would like to share something else that maybe wasn't. But those are some of the things that we talked about.
Great, Monica. Thank
Sí,
you
yo
for
quiero comentar algo,
Oh.
agregando un poquito a lo que estaba diciendo la persona que habló ahorita, Mónica. Sí, creo que es importante hacer mención y seguir informando a los trabajadores de que el COVID no se ha acabado, ¿verdad? El COVID sigue, el COVID sigue y por eso todavía sigue las vacunas y todo eso. Entonces, ahora sí que, como quien dice, el COVID llegó para quedarse, ¿verdad? Entonces tenemos que seguir informando sobre eso, que no se ha acabado, la importancia de la vacunación, de la prevención, de todo eso. Y por supuesto, como yo mencionaba anteriormente, y seguir y también Mónica lo mencionó, seguir explicándoles sobre los efectos, los síntomas que sigue dando para que no se confunda, como decía Mónica, con otros síntomas que pueden provenir de alguna enfermedad o como decía ella, en el caso del calor, ¿verdad?
Sí,
Sí, nada
Carlos
más.
mencionó eso y mencionó también que sí, porque hay una ola, ¿no? Una onda de que ya el COVID ya se fue. So there's this thing happening that, COVID is gone. And so people are believing that, and they're not taking the precautionary measures, which continuing maybe with their vaccines and things like that. So he mentioned the need for that. And also, one of the things that I brought up was is also maybe having clinics having a list of long COVID symptoms that are visible, right, for people, especially farm workers, or having that information at the centers where farm workers attend, so that they're able to see and identify, oh, that's how I've been feeling, and I didn't realize that it's long COVID. So because they're not going to go into a doctor's office and say, oh, by the way, I have long COVID because of, no, they're going to say like, I've been feeling really tired. I don't know, maybe it's because of the heat, but it's very important for health centers to probe, like, how long have you been feeling this way? Did you have COVID? Things like that, so that then they start to like relate it to that. So that's another thing that we brought up.
Thank you. So what I'm hearing from folks here is that first of all, for you who have that direct contact with farm workers and really working on getting information out there, that you do need the support of like healthcare organizations, health centers, to also keep this on their radar and to recognize that this is an issue, to help folks with long COVID symptoms, and also get that prevention message out there as well. Yeah, I think, we saw the interest in this webinar because we see how important it is that we still keep this on the radar for folks. COVID in general, we heard Roberto talk about that, this isn't over, it's still here, as well as, the long-term effects of COVID as well. So we're at the hour. Adriana, I see you have your hand raised. I just want to be mindful of folks' time. If people need to sign off, please feel free to do that. We will share the slides, we'll share the resources with you all, but really appreciate folks for coming today and asking very good questions. And thank you again for all the work that you are doing to support farm workers, their health, as well as their families. Adriana, do you want to ask your question?
So I guess my experience has been is that they don't want to believe they have COVID. So if they have sniffles, sore throat, they say, oh, it's a cold, it's a flu, I'll get over it, I don't have to take a test. So when we go to outreaches, we do give them a, take at home test. So maybe when we give them the bag, tell them that it's in there, and then if they ever have any sort of symptoms, don't just assume it's a cold or a flu, to take the test just to be sure.
Yeah, sure. I think that this is coming up, not just for farm workers, but I know that this is important because this is the work that you all are doing, that oftentimes, because a lot of the symptoms are very similar to other things as well. But I think as long as, we're keeping the message out there, keeping it on radar, if they are seeing a doctor, maybe the doctor, this is one of other things to screen for as well. And so I think it's important, the work that you all do out there directly with farm workers, to share this information with folks at health centers, but also I think it's our work too, to make sure that health centers are also aware that this is an issue and that we need to be screening for this, need to be aware and keep this on everyone's radar. So with that, I think, Sylvia, I don't know if you had anything else you wanted to share, but we are asking folks, thank you so much to the people that are still here. We have an evaluation. There is a QR code. Yvette, I'm wondering, should we just show that on screen? Before you all leave, we're gonna show that on screen so you can fill out the evaluation for us. We really appreciate that. We do take it to heart. We want to make sure that these trainings, these webinars that we do are what you all need and how we can, strengthen them as we move forward as well. So you can see on your screen, here's the evaluation survey. Thank you so much for joining us today. We'll stay on for a little longer for folks to be able to access this, and then I think we're going to wrap up for today. Thank you so much, everyone. We really appreciate you being here.